We just completed a study that really presented some very surprising results in terms of the impact of this oil catastrophe on children who are living near the coastline in Louisiana and Mississippi.
I'm a licensed clinical social worker working with families and children. My role is a mental health provider.
What we've done so far in Lower Plaquemines County and other parts of the Mississippi-Louisiana Gulf Coast is to just get an initial assessment. I don't think any of us actually expected such a large impact from a medical or psychological point of view.
We've seen everything. I mean, we've seen everything from children that are just having some behavior issues in schools to children who've begun to wet the bed. It's not normal for a 12-year-old to do those sorts of things.
We found that there was a significant amount of anxiety, in some ways as expressed by the children themselves even, feelings that were more depressing and more distressing to children than even Katrina was, which we also found very surprising. And when asked why, what was worse about it, there was a sense that Katrina was a horrible storm. It would wreck buildings and homes, but you could rebuild and come back home eventually.
Even though we talk about the recovery of the wetlands and the marshes, and especially now that the well is capped, temporarily at least, hopefully permanently, those sorts of things, there's still the uncertainty as to whether or not we'll be able to return to life as usual, meaning will the food be safe to eat? Will the cleanup affect our health? Has our health already been affected? Even the folks that we're meeting at these health fairs are mentioning how difficult it is to be a part of something that's so uncertain.
One of the other things that I think was interesting and important is the number of people that have made significant lifestyle changes, and especially when it comes to their children. People in droves, 80% or more are not eating local seafood. They're not going to the beach. They're not letting their kids play in the sand or go into the water. So there's been some significant disruption of the usual agenda of activities for families that has been generated by this. How long that will last, no one knows.
If there's a change in a way a child is acting, that's something that needs to be looked into. If a child is used to being very outgoing, or even a bit problematic, or a bit dramatic, or those kinds of things, and now the child's particularly quiet, that's a red flag we want to address before something traumatic happens to that child.
One of the interesting points that we discovered on our survey that's just released is that about 1 out of 4 people, 25% of the population, are thinking about leaving, moving away from the area. We had town hall meetings with kids in the range of 9 years to 18 years of age, and those children were expressing, surprisingly to us, a lot of concerns about their lifestyle. These children are 3rd, 4th, 5th generation living in these communities, and now they feel like their communities may be gone, they may have to leave and never come back.
We're hearing a lot of anxiety about the uncertainty of what the future holds. We can sometimes smell the oil burning in the air. We can sometimes see, the oil or the tar in our marshes. The uncertainty of all of that, whether if we're all going to have cancer, or if we're all going to have jobs, or if we're all even going to be able to live here because of toxins, there's anxiety around that. We've been exposed 100 days now. It's going to be 100 more before this is cleaned up. So it's an anxiety or an uncertainty that people are talking about.
There are real issues about whether or not there are immediate medical problems that have to be properly diagnosed and attended to. But mostly what we were getting was a lot of frustration and really unsettled uncertainty, and this was really bothering people. This oil catastrophe, whether the spill is stopped or not stopped, has left a mark, has left an imprint on children and families that for some families may be indelible.
We're in this together. I'm from here. I'm not planning to go anywhere. I want you to be okay so that our community is okay. I'm not just looking out for myself. As a mental health provider in this area, I understand the real concerns of the folks that live here. I'm one of them.